So hi guys, today we're going to do some cerebellar tests. The cerebellum of a patient may be affected and you may not recognize it right away unless you test the cerebellum. But first, before you do any of that, you ask for the patient's information. So hi, what's your name?
My name is Rachel Miguel.
When's your birthday?
The birthday is on October 12, 2001.
Next, you introduce yourself to the patient. So hi, I'm Raphael Miguel. I'm a medical student in the Manila Central University. So lastly, the most important thing to do before you do any of these tests is to ask for the patient's consent. I'm not going to ask for the patient's consent throughout the video, but this is what you normally do. So hi, I'm going to do cerebellar tests on you. Is that okay? So now let's proceed with the demonstration or the examination. A patient with cerebellar dysfunction varies from the head to the toe. So a patient, like with scanning speech, the patient may say something like British Constitution. The patient will say something like British Constitution. They put the words and break it down into individual syllables. So next, let's see if the patient has nystagmus. Nystagmus is when a patient has uncontrollable involuntary repetitive eye movements. So let's observe the patient's eye movements. So I'm going to ask the patient to follow my finger and look at her eyes without moving her head. Very good. The other side, please. Very good. Up. Very good. Up. Excellent. So lastly, if a patient has a problem in the vermis or the flocculonodular lobe, the patient may not be able to sit up straight and you may not get far into this examination. So now, continuing with the tests, we're going to do the finger to nose test to look for dysmetry. So the beauty of the cerebellum makes all of these joints in the hand, the agonist and antagonist muscles, move in one smooth motion. So now I'm going to ask the patient to do the finger to nose test. Please point your nose as quickly as possible. Now I'm going to ask the patient to point to her nose and do it to my finger. Excellent. Another test you can do is the rebound or overshoot test by Stewart and Holmes. This test puts resistance in the patient's arm. Put resistance. And when I quickly let go of the arm, the hand doesn't go and hit her in the face because the antagonist muscles in the hand quickly stops the motion. However, in a patient with cerebellar disease, you may have to protect the patient by putting an arm across the shoulder and putting resistance in the hand. Put resistance in the hand. One more time, please. A patient with cerebellar dysfunction may hit her face when you do the overshoot or rebound test. So last, for this OSCE guide, we're going to ask the patient to do rapid alternating movements. So place your hand out, do this quick motion. The other hand, please. Excellent. So with a patient with cerebellar dysfunction, this motion is not possible because of a disease called dysdiadochokinesia. Its complete inability is called adiadochokinesia. And that completes most of our cerebellar tests. After doing that, you have to thank your patient. Thank you very much. In summary, this patient has a normal and intact cerebellum. To further complete your examinations, you may do a knee reflex, assess your patient's coordination, and do a full neurological examination of the upper limbs, the lower limbs, and the patient's cranial nerves. So that's it for this OSCE guide. Thank you very much. This has been Raphael Miguel, and have a good day.